Are you experiencing difficulty engaging one side of your buttocks due to one side low back pain and weakness? Hi, my name is Annie and welcome back to my channel, Annie Pilates Physical Therapist. Join me for a gentle glutes activating and core lumbar stabilization to help balance a lateral pelvic tilt with stiffness and tightness and pain in one side of your low back area. So get your mat ready and a gentle elastic band to join me today. If you're new to my channel is about Pilates, yoga, physical therapy, health, and wellness. And I have a lot of videos about one-sided weakness, and there's a playlist you can check out over here. And I recommend you to learn more about quadratus lumborum pain and also dead butt syndrome that you can check out over here. So if you're ready and you want to progress, elastic band is a great way to really activate your muscles, slow connection, mind-body awareness, because with pain, you have a disconnect with your body, which means with the global pain in that area, it's hard to activate the muscle. What pain does, it weakens the muscles and it makes a little bit difficult to engage the muscle because, of course, when you're in pain, you don't want to move it. That's why you need to slowly connect and do a proper breath work to help relax the muscles. So with this video, we're going to use the elastic band, placing this around your thighs and making sure the resistance is not too much. 1 pound resistance after 25 percentile is a good stretch for absolute beginners. However, if you're exercising and there's no proper movement with your hips and you end up with trunk twisting and your lumbar spine rotating, I would rather you do the exercises in the right form, keeping your spine in neutral position, all at the same time engaging your glutes. Because if you're compensating and using other muscles, then I would recommend and suggest do these exercises without the band. So for those who could connect without the band, you can progress now with the elastic band around your thighs. And you can also improvise using some dumbbells or a small ankle weights, like a 1 pound ankle weight or a dumbbell that you can wrap around your knee area. So let's begin the program. We're going to start with proper breath work. Place your hands behind your thighs, slowly roll down 1 vertebrae at a time. Hold tight and then breathe out with your knees bent. This will help your spine. And then placing one hand at the small of the back. This is neutral spine and it's important to keep that small curvature. And one hand on your abdomen. As you inhale, belly rise, exhale, squeeze your core in. As you breathe out through your mouth, you're going to pull your navel towards your spine. It's like tightening abdominal bracing. Inhale. Try to expand your rib cage and you can feel your abdominal muscles rise a little bit. As you breathe out, slowly squeeze your core in while everything keeping your spine in neutral. You're not pressing your spine towards your hand. You want to keep that small space and then breathe out. Last one, inhale and breathe out. The first exercise, we're going to slowly lower one knee to the side, keeping the other knee pointing to the ceiling. So I'm going to lower my right side. So if your problem side is your right, you're going to start with that first. So you're going to feel the tension on the opposite leg. Inhale and then exhale, press your knee out, squeezing your core in. Try your best not to twist, keeping your pelvis center. If you place a cup of coffee, it's not spilling to the right. Keeping it center and then exhale back center. And then you alternate to the other side. The purpose of that, so you can compare which one is your stronger side. And you might find, oh, the painful side has less strength. But sometimes you'll be surprised that area where you have more pain could be the area you're leaning a lot on that area and it's stronger. So there could be a compensating pain or a weakness pain due to injury. So there's 2 types of pain. And you might find out, hey, I'm stronger on the painful side, which means I'm just having more pain and stiffness there because I'm leaning on that side. Or you're having more pain on that side because it's the area where there's nerve damage. So you want to keep your spine neutral. I'm not twisting my spine, engaging everything, mind, body awareness. Slowly left and right 5 times. Warming up your hips, slow and steady. So this is a gentler version. Lying on your back with your breath work. Inhale, exhale as you exert the effort, keeping your pelvis neutral. Imagining if there's a cup of coffee here, it's not spilling to the side. Tightening as I open my knee out one side. Inhale, exhale. Last set. 5 times each leg of your hip opening. And then your left side. Inhale, exhale. The next progression, we're going to open your knees all at the same time. So this is butterfly stretch. You're going to open your knees as much as you can. Open, keeping that neutral spine, placing one hand at small of the back. Breathe in, breathe out. Inhale, exhale, squeeze your knees out, squeeze your core in. Inhale again, and then exhale, going back to the center. So we're going to do 2 deep breaths. So inhale, before you exert the effort, open your knees out. As you breathe out, you're going to feel some twinge on the painful side, as long as it's not excruciating pain, just a weakness pain. Inhale again, and then breathe out, slowly go back center. Slow and steady. Inhale, exhale, open again. Feels good on your back. Learning how to stabilize your spine. Breathe in, breathe out, center. Knees together. Inhale, open, your knees apart, squeeze your core in. Inhale again as you reach that end range of hip opening. And then breathe out, center. Slow and steady, not staggering movement. Inhale, and then open. Feels so good on your back, slowly activating it. Breathe in, and then breathe out. Last set. Inhale, exhale, open. Breathe in again, and exhale. Now we're going to do bridging. Bridging, placing your hands on the side of your hips. We're going to slowly lift your hips up off the mat. You want to make sure you really stabilize and not shake your hips. So there's a lot of patients of mine with back pain, they can't lift properly. They start shaking from the lower part. I'd rather have it lower than go all the way up and you're shaking all the way through. So there's no stabilization. So it's a lot of importance to keep that mindfulness. So inhale, belly breath, slowly lift. If this is all you can do, that's fine. Try not to arch your spine, keeping your core stable. And as you reach the highest point, you inhale again, belly breath, expand your rib cage, and then squeeze your core in, squeeze your glutes, tighten as hard as you can, and then slowly roll down bone to the mat. So it's like you're stacking it slowly down to the mat, doing a gentle lumbar mobilization. You're not plopping down, you're going to slowly touching the mat as you breathe out. Inhale and lift. Squeeze your glutes as hard as you can. So imagine if you put a penny between your butt crack. I know it's so funny every time I tell this to my patients so they won't forget. And if you put that mindfulness, you put that penny there, imagining it only, of course, it makes you connect. And you're going to tighten as hard as you can. Wake up those weak glutes. Inhale. As you reach the highest point, try not to overarch your spine. Mindfulness. Exhale, squeeze your core in and then roll down. Inhale, lift. Breathe out. Roll down. 2 more. Breathe in. And breathe out. Last one, we are progressing. Breathe in. And then hold that bridge. Hold that glutes tight. And this time we're going to progress. Keeping that pelvis level. I'm going to open one knee at a time. I'm starting with my right. Inhale. Exhale. Try your best not to twist your spine and then twist and open the other leg. No twisting. So I'm keeping my hands on the side of my pelvis and then my elbow helping support that. I'm pressing my elbows down to the mat and then I'm slowly opening one knee at a time so the elbows help support my spine. So this is really a glute bridge, all at the same time hip opening, activating those deeper hip external rotators. Inhale, exhale. Switch again to the other side. Help the glutes with your elbows. 2 more. Inhale, exhale. Last one. And then slowly roll down, bone to bone, down to the mat. Whew, you're gonna feel that glutes activated. Now we're progressing again. Bridge, hold that bridge, hold that hips with your hands on your side, elbows really pressing down to the mat to support. And then you're gonna slowly butterfly, open and close, keeping your feet level to your knees and your big toes really pressing down to the mat. You don't wanna lift those big toes or else you're not using your glutes. Once your big toes lifting up, then you are compensating with your other parts of your hips. You wanna really activate by pressing your big toes down. It's like you're pressing down to the mat. Inhale, open, and exhale, center. 4 more. 3, 2, feel the burn. And 1. And roll down bone to the mat and exhale. Whew. After doing that lovely lie on your back, you're gonna lie on your side. So if your problem side is your left, this is the area we're gonna do extra set of exercise with your hips level to 45 degrees, knees slightly bent to 45 as well. You can place one hand on your hip or one in front of you, and we're going to slowly clamshell. It's one of my favorite to activate your glutes. You can tap your hip to wake up a dead bud syndrome, mind body awareness, your neuromuscular reconnection. So the sensation part is so important to really imagine and contract those weak muscles. So open, inhale, try not to twist, lean back, keep your body forward, exhale down. 5, 4, 3, feel the burn here, 2, and 1. And now we are progressing by engaging with the side plank. With your elbow level to your shoulder, knees slightly bent. If this is too difficult and you can't do side plank, continue just clamshell. Know what your body could handle. Everyone is different. Place your hand in front of you and then bridge to lift side plank. So it's like a side movement with your hand up for extra challenge or front of you for support for those who are really weak. And then you clamshell. 10, 9, keep your core engaged with each breath work. 8, 7, 6, 5. You can challenge lifting your hand up. 4, 3, 2. We're almost done. And 1. And hold it there and down. Now we're cooling down now with some gentle stretching. Your glutes and your hips. Remove the band. Lie on your back. Place one foot, starting with your left, on your thigh and press your knee out. Inhale, exhale, pull. Breathe in, breathe out. Feel that release on your back and your hips. 4 more. Last one. And then hug your knees to your chest. Rock side to side. Feel that deep stretch on your glutes and your piriformis. Now let's switch to the other side. Place your right ankle and foot on the opposite thigh. Press out first and then in. Exhale with your breath work. Feels so good on your hips and your back. 2 more. Last one. And hug your knees to your chest and rock side to side. Now you can use the elastic band to stretch your hamstrings. I'm going to place it on the arch of my left foot with my knee bent. I'm going to extend and bend. Inhale as you bend. Exhale as you stretch. Stretch your hamstrings as much as you can, keeping the other knee bent to support your spine. We're cooling down properly. 4 more. 3. Feels so good on your hamstrings and your calves. 2. And 1, hold that hamstring stretch, keep your knee locked, and then you're going to open to the side for a V stretch. I'm opening my hip groin area on my left, and then I'm moving it across my body to stretch my IT band. Left and right, keeping my spine planted on the mat with my breath work. Last one. And now we're gonna switch the other side. Now my right foot, arch of my right foot, I'm gonna bend and extend. Feels so good. You might find, hey, this side is a little bit tighter, but no pain. So that could be the area where your hamstrings are overworked due to the weakness of your glutes on one side. And it happens a lot. 2 more. Last one. Hold that stretch, and then now I'm going to open side to side. Inhale, exhale, cross my body with a little bit ankle movement for a beautiful stretch on the side of my ankle. Open as much as I can, and then across. 2 more. Last one. Inhale and exhale. And that's it. I'm hoping you enjoyed this lovely glutes activating lumbar stabilization with some lovely stretches to help relieve the tension on one side, pain and weakness. And if you love this video, want to learn more about Pilates, yoga, and physical therapy, health, and wellness, please subscribe to my channel, ring the bell so you won't miss anything, like and share this video. Every like you give to my channel, you are supporting me. And if you need my help and guidance, you can join my back masterclass right now. It's still open, and I'm still welcoming new students who need to be guided safely and effectively with my Zoom meeting calls, hand in hand, reaching your goals. If you have any questions, suggestions, or concerns about that, leave a comment down below on how to join the program, or you can directly email me on my other social media so you can learn how to get access to this lovely back masterclass. If you have time today, please watch this video about quadratus lumborum pain, and this is the next progression, align video, how to align it with a gentle progression. Always remember, be safe, be well, and healthy you. Bye!